Hello, my name is Dr. Dewan S. Raja. Today I will discuss a few multiple choice questions on anemia. Question number 1. A 43-year-old female presents with fatigue, weakness, palpitation, and pallor. Recently, she developed restless leg syndrome. She reports heavy menstrual periods. Laboratory results reveal low hemoglobin, low mean corpuscular volume, low serum ferritin levels, and high total iron binding capacity. What is the most likely diagnosis? Okay, we are looking at the smear. We are seeing cells are pale. We just got one need to fill here. This RBC seems to be very pale and they have low MCV, mean corpuscular volume. Our choices are like this: folate deficiency anemia, vitamin B12 deficiency anemia, C hemolytic anemia, D iron deficiency anemia, E anemia of chronic disease. So what is the most likely diagnosis from this smear? And we are also getting this MCV, low serum ferritin level, and certainly high total iron binding capacity. Answer should be D, iron deficiency anemia. D, iron deficiency anemia. Okay, we got that. Question number 1, answer is D. Question number 2. A 45-year-old male with a history of chronic gastrointestinal bleeding due to peptic ulcer disease presents with fatigue and shortness of breath. Laboratory findings show microcytic hypochromic anemia. What is the most appropriate initial test to confirm the suspected diagnosis? Okay. Our choices are serum iron level, B total iron binding capacity, C ferritin level, D peripheral blood smear, E hematocrit. So, what is the most appropriate initial test to confirm the suspected diagnosis? We are suspecting microcytic hypochromic anemia. So, we are suspecting it is a case of iron deficiency anemia. Yes, because it is an iron deficiency anemia, what would be the most appropriate initial test to confirm the suspected diagnosis? Answer should be ferritin level. Okay, initial test. We have other tests like total iron binding capacity, peripheral blood smear, but from this history, first of all, we will go through C, the initial test to diagnose iron deficiency anemia, that is ferritin level. Question number 3. A 28-year-old pregnant woman is found to have iron deficiency anemia during routine prenatal screening. She has developed a desire to eat ice and mud frequently. What is the preferred first-line treatment for iron deficiency anemia in pregnancy? Choices are oral iron supplementation. So A, oral iron supplementation, B, intramuscular iron injection, C, blood transfusion, D, vitamin B12 supplementation, E, vitamin A supplementation. What is the correct answer for the first line treatment for iron deficiency anemia in pregnancy? She has developed food fan, okay, like that of some type of altered behavior in eating during the pregnancy, food fat that may develop. Some people like to eat mud, okay, like this. So this is not unusual, and it may be due to iron deficiency anemia. So what is the first line of treatment for an iron deficiency anemia in pregnancy? Answer should be A, oral iron supplementation. Oral iron supplementation. This is the answer. Oral iron supplementation. Question number 4. An elderly male presents with fatigue, glossitis, and difficulty swallowing. Laboratory tests show a macrocytic anemia. What additional investigation is essential to determine the cause of the anemia? So, elderly man, fatigue, glossitis, inflammation of the tongue, and difficulty swallowing, dysphagia. Laboratory test shows macrocytic anemia, not microcytic. Macrocytic anemia. What additional investigation is essential to determine the cause of the anemia? A. Serum ferritin level. B. Schilling test. C. Reticulocyte count. D. Hemoglobin electrophoresis. E. Total iron binding capacity. Okay, so this is elderly person. These are the features. Most likely vitamin B12 deficiency anemia. So we will go through Schilling test. B is the answer. Schilling test. B is the answer. Okay. So diagnosis of vitamin B12 deficiency anemia. Here is macrocytic anemia plus glossitis, fatigue, and elderly person. So we'll go through Schilling test. Question number 5. A 19-year-old vegetarian female complains of weakness, palpitation, and headaches. On examination, her conjunctiva appears pale and her fingernail looks flat. Laboratory results reveal microcytic, hypochromic, which means less amount of hemoglobin, less in size of the RBC, and increased red blood cell differential width. Width is variable from one RBC to another RBC. Okay. What is the most likely cause of her anemia? Vitamin B12 deficiency anemia, folate deficiency anemia, sickle cell anemia, hemolytic anemia, iron deficiency anemia. So what is the most likely cause of her anemia? Answer should be iron deficiency anemia. And these are the answers. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.